Good morning. This morning was supposed to be a funny video. Some of the people giving me some of my constructive criticism told me yesterday I needed to make a funny one. But last night I had a bad night from steroids. I was up most of the night. And then I finally went to sleep this morning. I woke up so sick on my stomach, but I took something to try to get my stomach under control. But what can be funny about living with cancer? Well, I got to thinking about something that happened, and it's an invasive procedure that you have done when you got blood cancers. But it was kind of funny after it was all over with. And what it was is I had went in 1 week to have a diagnosis for this amyloidosis, and one of the ways they do it is they'll do a what they call a fat pad biopsy, and what they do is they get part of the fat off your stomach, send it off, and it'll tell whether you have amyloidosis or not. Well, when I went in, y'all have to excuse me, I'm a little short of breath this morning. When I went in that morning, there was a regular lady in there, I guess it's a regular lady, and then her assistant, and then there was another little old lady in there. And when I say little lady, it's anybody, when you're my age, anybody under 30 years old is a little old lady. Not a little old lady, a little old girl. So anyway, I get in there and they're teaching her how to do the fat pad biopsy, which it didn't bother me. You know, everybody's got to learn, so they're going through the procedure and they teach her how to get the fat pad biopsy and everything. And they send it off. Well, the thing comes back negative. So I'm like, oh man, they already said I've got this disease, but it's showing up negative. So I go back to the doctor. I don't know if I went that day or another day. Usually with Mayo, you go back the same day, but with that fat pad biopsy, it takes a little while, a couple weeks to get that back. But anyway, went to the doctor, and the doctor said, well, that come back negative, so we've either got to biopsy your heart and your kidneys, or we got to do a bone marrow biopsy. And he said he preferred to do the bone marrow biopsy. And I thought to myself, yeah, you ain't the one getting it, because I'd had one in the past. So I get scheduled, I go in for the bone marrow biopsy, and I get in there, and here comes that little girl in there and her assistant. And I'm like, huh, last week she was just learning how to do the fat pad biopsy, which I could do myself if you give me a needle. And now she's in here doing the bone marrow biopsy. So I got a little anxious, you know, because you're anxious when you go in there for the bone marrow biopsy anyway, because I didn't get any sedation or anything. I never do. If I can do without it, I go without it. So I lay down on the bed, you know how you lay down on your stomach, and she starts feeling around on the bone to find the place, I guess, where she wants to go in and get the biopsy. And that's normal. They'll feel around, you know, even somebody that really knows what they're doing, they'll feel around till I guess they find the exact spot they want. And she starts putting the lidocaine in to kill the pain, you know, and everything's going along good. And so then she gets the needle that she's gonna get the biopsy with, and if you don't know what it looks like, it's kind of like a T where they can drill once they get in there. And the needle's probably about big round as pencil lead. So she starts drilling, and she drills, and she drills, and she drills, and I'm like, we're not making progress here. So I think it rocked on for 15 or 20 minutes, and I thought to myself, just give it to that big guy there. He could push it on through there. But I didn't say nothing. I just lay there and endure it. And she's drilling, and I'm thinking, we ain't gonna get it. So at that time, she told her assistant, she said, go get so-and-so. Well, so-and-so happened to be the woman that was training her the week before. And I'm like, thank goodness we got somebody to push it on through there. So she gets up there and she drills it on through there. But the little old girl, she was she was really downtrodden after that, you know, that she couldn't get it. And I told her, I said, don't worry about it. I said, everybody has to learn sometime, and I just happen to be the one you got to learn on. But if you go, I think if you're gonna be doing them bone marrow biopsies, you got to be bigger than that little old girl. But I guess she could have done it. You know, all she got to do is get up there and start applying pressure. So there's no reason why she couldn't have got it through there. She probably was just nervous and didn't have the confidence to drill it and push it on through. But that was the funny thing that happened. One of the funny things. I can't think of a whole lot of funny things when you live with cancer. You know, there's not a lot of fun with it. But that was kind of funny how that all played out. Well, that little girl, she couldn't get it through. But hopefully the next one that went in, she got it through there. But that's the funny thing I can tell you about. One of the funny things. And if you think of something you want me to write about, just put it down in the comments, and I'll write about it. I'm trying to get started to go back to where I started in 2016. That's what I'd planned on today, but they wanted me to do a funny one, so I done this one. But if you enjoyed this video, subscribe. If you don't subscribe, you're not going to know when I get updates, and I can't keep putting on Facebook and all them social medias because I get confused and forget which one I put on, which one I hadn't. So subscribe, just click that little red button, and that'll let you know when I put another one out. But I'm fixing to go in. It's about 9 something this morning in Florida, and it's already, it feels like it's 100 degrees. But y'all have a good day.